Hello everyone and welcome to Know Your Drug, powered by MediInsights. The ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Romiplostim Injection, exploring the various aspects of Romiplostim, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Romiplostim Injection. Romiplostim is primarily used to treat thrombocytopenia in patients with chronic immune thrombocytopenic purpura who have not responded adequately to other treatments such as corticosteroids, immunoglobulins, or splenectomy. It helps increase platelet production to reduce the risk of bleeding. Next, dosage of Romiplostim Injection. The dosage of Romiplostim is individualized based on the patient's platelet count. The starting dose is typically 1 microgram per kg, administered as a subcutaneous injection once weekly. The dose can be adjusted weekly by increments of 1 microgram per kg to achieve and maintain a platelet count more than 50,000 per microliter without exceeding a platelet count of 400,000 per microliter. The maximum dose should not exceed 10 micrograms per kg per week. Romiplostim is a prescription medication and should be used under the supervision of a doctor. Next, mechanism of action of Romiplostim Injection. Romiplostim is a thrombopoietin receptor agonist. It mimics the action of thrombopoietin, a natural hormone that regulates platelet production. Romiplostim binds to the TPO receptor on megakaryocytes and their precursors, stimulating the production and maturation of these cells, which ultimately leads to an increase in platelet production. Next, side effects of Romiplostim Injection. Common side effects include headache, dizziness, insomnia, and injection site reactions. More serious side effects may include thrombotic or thromboembolic complications, bone marrow fibrosis, and hypersensitivity reactions. Patients may also experience an increased risk of reticulin fiber formation in the bone marrow, which could lead to bone marrow fibrosis. Next, important advice for using Romiplostim Injection. Regularly monitor platelet counts to avoid excessively high platelet levels and adjust the dosage accordingly. Be aware of and report any signs of thromboembolic events, such as chest pain, shortness of breath, or swelling in the limbs. Monitor for signs of bone marrow changes, such as unexplained bruising or bleeding. Inform your healthcare provider of any other medications you are taking to avoid potential interactions. Patients with hepatic impairment should use Romiplostim with caution, as it can increase the risk of thromboembolic events. Romiplostim should not be used in patients with myelodysplastic syndrome due to the risk of increased blast cell counts and potentially evolving into acute myelogenous leukemia. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using Romiplostim Injection. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.